Hello everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. Now in this recording, we will be looking at hand expressing, and I have highlighted it for you on the list of topics that we are covering in this breastfeeding class series. So why do you think mothers need to learn how to hand express? Well, it may be useful to know how to hand express for breast comfort, such as to relieve engorgement, or maybe dab a few drops of milk on the nipple to soothe it if it's tender, or maybe express to soften the areola if the breast is really full and the baby need to attach to the breast, or maybe to encourage the baby to breastfeed. Express some milk onto the nipple, help the baby smell and taste it. Some others even express milk directly into the baby's mouth. A mother can also express to keep up her milk production when the baby is not suckling, or you can express to increase milk production, or mothers express when they are separated from their baby to obtain milk if the baby is unable to breastfeed directly, or for a baby who is small and tires quickly and they need a supplement. Or maybe a mother wants to provide milk for a milk bank, or a mother might want to pasteurize the milk for a baby as an option if the mother is HIV positive. So hands are often much better in stimulating an oxytocin reflex because the hands are attached to your brain. And hand expressing is usually gentler than a pump, particularly if the mother's nipples are sore. Okay, so the trick of milk expressing is focusing on triggering an oxytocin reflex and then expressing during that moment of peak flow. And the keys in order to hand express are encourage the milk to flow, find the milk ducts, compress over the breast over the ducts, and then repeat in all parts of the breast. So it is easier to learn how to hand express when the breasts are soft rather than when they are engorged and tender. Now, why do you think, number one, do we need to or should we encourage, or how do we do it, encourage the milk to flow? Why should we encourage the milk to flow? How do we encourage the milk to flow? Well, if you remember from a previous recording, if it takes the baby at the breast about a minute to a minute and a half to stimulate the oxytocin reflex so that the oxytocin can come back in the bloodstream to the breast and contract the muscle cells surrounding the milk-making cells and squeeze out the milk so the baby can get milk. Remember, baby starts sucking with this chick, 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 chick. And then that sends a nerve impulse to the brain, hormones comes back to the breast, squeezing out the milk, and then the baby gets lots of milk, and the baby's suckling changes to that type of suckling. So if all this whole process happens with the baby at the breast, it would make sense that in order to express by hand or with a pump, we need to stimulate an oxytocin laydown. Because if there's no laydown, it means no milk, or at least very, very little milk. So to encourage the milk to flow involves stimulating the oxytocin reflex, waking up the breasts, or asking the milk to come out. And a mother can help her oxytocin reflex work by being comfortable, by thinking about her baby, looking at the baby, or even a photograph, smelling the baby's clothes, if the baby's not nearby. Smell is very powerful. She can also warm her breasts, maybe with a lukewarm face cloth. And once she's done that, then she can proceed to gently manipulate her nipple by rolling it gently between her thumb and finger, or she can hold and lift the nipple in different directions, kind of mimicking the baby's sucking. To gently tilt the nipple north, south, east and west. And next, walk with the fingers on the areola to further dilate ducts because milk making tissue is right underneath the areola, and then start to loosen the milk from the little alveoli or the milk producing cells by gently massaging the breast itself. So the suggestion is the pressure of massaging the breast is similar to petting a cat, because the breast is an organ, it is not a muscle. So a common technique is a fingertip massaging, also called dancing fingers. So you'll just be moving your fingertips in high frequency on the breast. Another approach is gentle vibration of the fingers placed over an area and then just oscillating them back and forth. The marmot techniques describes pressing the fingers gently into the chest wall and then moving the fingers slowly, pressing firmly in a small circular motion on one spot on the skin, and then after a few seconds pick your fingers up and move it to the next area on the breast, but don't slide your fingers on the breast, and then just massage the breast, moving all around the breast, and then very, very gently stroke or knee or walk the milk down with the fingertips or the knuckles from the chest wall towards the nipple, all around the breast as well. And some mothers also gently rake the breast from the chest wall towards the nipple with a gentle tickle-like stroke all around the whole breast. And this will also help with the relaxation and encourage the oxytocin reflex. Some mothers will also lean forward and jiggle their breast gently, so gravity can also help. And mothers can get their oxytocin reflex to work more easily with practice. The next step is to find the milk ducts. So a mother can gently feel the breast near the outer edge of the areola, depending on the areolar size, or about a thumb joint back from the nipple base, which is about 3 centimeters from the nipple. And she can feel for knotted string or a tiny row of peas, or it might feel like BB gun bullets near or behind the areola, again depending on the areolar size. And most of the milk making tissue is located within a 3 centimeter radius of the base of the nipple. So this is why we feel kind of that area. Okay, so with the thumb on one side and the fingers on the other side, press the thumb and the fingers together, compressing the milk ducts between them. And some people will roll the nipple, roll the fingers towards the nipple without lifting them from the breast, because sliding might bruise the skin. Some describe this action as pressing the fingers back towards the chest wall and then bringing the fingers together and gently pulling them towards the nipple. Some people will even suggest lifting the breast with the pinky ring and middle finger, and then pressing the fingers backwards towards the chest, and then bringing the fingers together, squeezing out the milk. And then release and repeat the compression and release movements until the milk starts to drip out. And it might take a few minutes. And milk will spray out in streams after the oxytocin reflex starts to work. And after a few compressions, when the milk stops flowing, just move the fingers and thumb around the edge of the areola to another section, say 3 o'clock or 9 o'clock position, and then just repeat the press and release movements. And when the flow ceases, pause to massage the breast again, and if needed, go back and forth between breasts a few times. The marmot technique suggests to express each breast 5 or 7 minutes, and then massage and stroke and jiggle each breast again for about a minute, and then express each breast 3 to 5 minutes, and then massage, stroke and jiggle each breast about a minute, and then express each breast 2 to 3 minutes. Now, to hand express milk adequately, maybe it might take about 20 or 30 minutes. And no two women use the same technique to hand express. We are all different, and what works for one mother might be different for what works for another. Now, a mother needs to know her breasts and the best place to apply pressure for maximum effect. but please avoid rubbing or sliding fingers along the skin. It's more a rolling action. And also avoid squeezing close to the nipple or pressing or pulling the nipple itself. That cannot express milk. It's the same as the baby just sucking on the nipple. And expressing shouldn't hurt. If it hurts, check your technique with someone trained in breastfeeding support. Okay, so how long and how often does a mother need to express for? If, now really these are just suggestions. Now on day 1 and 2, when expressing colostrum onto a teaspoon for a non-feeding newborn baby, a mother can express maybe every hour or 2 hours until the baby is able to attach and feed effectively. Now colostrum is thicker than later milk, so it doesn't spray or spurt out from the breast. And the amount of milk a mother expresses will increase quickly after the first day or two, and then she'll express easier, and the milk will come out easier and in spurts. If a mother is expressing to increase her supply, she could express a few minutes after each feed. And if she is expressing for a baby who is not feeding at the breast, she could aim for 20 or 30 minutes at least 7 or 8 times in 24 hours when she's hand expressing. If she is using a breast pump, she can maybe express 10 or 20 minutes for 7 or 8 times. And again, these are just suggestions. Okay, thank you so much for watching this recording. In the next recording, we will be looking at using a breast pump. So please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.